Hey everyone, it's Dr. Mike. Today we're diving into a topic that affects millions around the world: diabetes. At its core, diabetes is about how our bodies use sugar, or glucose. Glucose is fuel for our cells, giving us energy. Insulin, made by the pancreas, helps glucose enter cells. If insulin doesn't work properly, glucose builds up in the blood. This can cause various health issues over time. Understanding diabetes empowers you with knowledge. There are two main types of diabetes. Let's start with type 1 diabetes. It often develops in childhood or adolescence. The immune system attacks insulin-producing cells in the pancreas. This disrupts insulin production. Without insulin, glucose can't enter cells. This leads to high blood sugar levels. Lifelong insulin therapy is required. This involves regular injections or an insulin pump. Genetics and viral infections might play a role. Careful monitoring and healthy lifestyle choices are essential. Now let's talk about type 2 diabetes, the most common form of the condition. In type 2 diabetes, the body either doesn't produce enough insulin or the cells become resistant to its effects. It's like the key is there, but the lock on the cell door isn't responding to it as it should. This resistance to insulin means that glucose can't enter the cells as easily, leading to a buildup of sugar in the bloodstream. Type 2 diabetes often develops gradually, and many people don't experience noticeable symptoms in the early stages. Factors like family history, obesity, physical inactivity, and age can increase the risk of developing type 2 diabetes. The good news is that lifestyle modifications can play a significant role in managing and even preventing type 2 diabetes. Adopting a healthy diet, engaging in regular physical activity, and maintaining a healthy weight can improve insulin sensitivity and help keep blood sugar levels in check. Diabetes, if not managed properly, can lead to various complications over time. These complications arise from prolonged exposure to high blood sugar levels, which can damage blood vessels and nerves throughout the body. Let's shed light on some of the complications associated with diabetes. One major concern is cardiovascular disease. High blood sugar can damage the lining of blood vessels, making them more susceptible to plaque buildup. This can lead to conditions like heart disease, heart attacks, and stroke. Nerve damage, also known as diabetic neuropathy, is another common complication. High blood sugar can impair the function of nerves, causing symptoms like numbness, tingling, pain, and weakness, particularly in the extremities. Diabetic retinopathy is a complication that affects the eyes. Elevated blood sugar levels can damage blood vessels in the retina, the light-sensitive tissue at the back of the eye. This can lead to vision problems and even blindness if left untreated. Knowledge is power, especially when it comes to managing diabetes. Understanding the different types of diabetes, their causes, and potential complications is crucial for taking control of your health. Remember, diabetes is a manageable condition, and with the right knowledge and support, you can live a full and active life. Throughout this series, we'll dive deeper into specific conditions related to diabetes, providing you with the information you need to make informed decisions about your well-being. We'll explore the intricacies of diabetic ketoacidosis, or DKA, diabetes insipidus, and hyperosmolar hyperglycemic non-ketotic syndrome, breaking down these complex medical terms into easily understandable concepts. We'll discuss their symptoms, causes, treatment options, and preventive measures, empowering you to take charge of your health. Welcome back. Let's dive into our first condition related to diabetes: diabetic ketoacidosis, or DKA for short. Now, I know medical terms can sound intimidating, but stick with me. We'll break it down together. DKA is a serious complication of diabetes, most commonly seen in type 1 diabetes, but it can occur in type 2 as well. Remember how we talked about insulin being like a key that unlocks cells for glucose to enter? Well, in DKA, there's a severe insulin deficiency. It's like having a bunch of locked doors and no keys in sight. When this happens, the body can't use glucose for energy. Instead, it starts breaking down fat for fuel. Now, this might sound like a good thing, like your body's using its backup energy reserves. However, breaking down fat for energy produces ketones as a byproduct. While ketones can be used as an alternative fuel source, high levels of ketones can become toxic, making the blood acidic. To understand DKA, let's delve into the science behind it. Imagine your cells are like cars, and glucose is their gasoline. Insulin acts as the key that unlocks the car doors. In DKA, this process is disrupted. Without enough insulin, glucose can't enter the cells. It's like having a full tank of gas but no key. The cells are starved of energy. This is where fat breakdown kicks in. Fat breakdown produces ketones. Think of ketones as a backup fuel source. High levels of ketones can disrupt pH balance. This is why it's called ketoacidosis. Recognizing the warning signs of DKA is crucial, as early detection and treatment are vital for preventing serious complications. DKA typically develops gradually, and symptoms may worsen over time. One of the most common symptoms is frequent urination, as the body tries to flush out excess glucose through the urine. Increased thirst is another telltale sign, as the body tries to compensate for fluid loss due to frequent urination. Nausea and vomiting are also common symptoms of DKA, as the buildup of ketones can upset the stomach. Abdominal pain is another red flag, often described as a dull ache or cramping sensation. As DKA progresses, more severe symptoms may arise. These include confusion, difficulty breathing, fruity-smelling breath due to the presence of ketones, and even loss of consciousness. If you or someone you know experiences any of these symptoms, especially in the context of diabetes, it's essential to seek immediate medical attention. Diabetic ketoacidosis doesn't just happen out of the blue, it's usually triggered by a combination of factors. Understanding these causes can help us take proactive steps to prevent DKA from occurring in the first place. One of the most common triggers is missing insulin doses or not taking enough insulin. This is especially crucial for people with type 1 diabetes, who rely on insulin injections to regulate their blood sugar levels. Insulin pumps, while generally reliable, can malfunction or become dislodged, leading to insulin deficiency. Illnesses and infections can also increase the risk of DKA. When the body is fighting an infection, it releases hormones that can raise blood sugar levels. This increased demand for insulin can overwhelm the body, leading to DKA, particularly if insulin doses are not adjusted accordingly. Certain medications, such as corticosteroids, can also interfere with insulin's action, potentially triggering DKA. Additionally, stress, both physical and emotional, can release hormones that raise blood sugar levels, increasing the risk of DKA. If you or someone you know experiences the symptoms of DKA, it's crucial to seek immediate medical attention. DKA is a serious condition that requires prompt treatment in a hospital setting. The primary goals of DKA treatment are to rehydrate the body, correct the high blood sugar levels, and restore the body's electrolyte balance. Intravenous fluids are typically administered to replenish fluids lost through excessive urination. Insulin therapy is also a cornerstone of DKA treatment. Insulin is typically given intravenously to quickly lower blood sugar levels and stop ketone production. Electrolyte replacement is often necessary, as DKA can cause imbalances in essential minerals like potassium and sodium. Throughout treatment, blood sugar levels, ketone levels, and electrolyte levels will be closely monitored to ensure the body is responding appropriately to treatment. The length of hospital stay can vary depending on the severity of DKA and how quickly the body responds to treatment. Preventing DKA is always preferable to treating it. By adopting proactive measures, individuals with diabetes can significantly reduce their risk of developing this serious complication. One of the most important steps is to carefully follow your diabetes management plan. This includes taking insulin or other medications as prescribed, monitoring blood sugar levels regularly, and maintaining a healthy lifestyle. Knowing the signs and symptoms of DKA is crucial. Early detection and treatment can make a significant difference in outcomes. If you experience any of the warning signs, don't hesitate to contact your healthcare provider immediately. Having a plan in place for sick days is also essential. When you're ill, your body's need for insulin may increase. It's important to discuss with your doctor how to adjust your insulin dosage or other medications during times of illness. DKA can affect people of all ages, including children. In fact, it's one of the most common diabetes-related complications in children and adolescents. Because children's bodies are still developing, they may experience more rapid changes in blood sugar levels and be more susceptible to dehydration, making them particularly vulnerable to DKA. Recognizing the symptoms of DKA in children is crucial. While some symptoms are similar to those in adults, children may also exhibit behavioral changes, such as irritability or lethargy. It's important for parents and caregivers to be vigilant about managing their child's diabetes, ensuring they receive their insulin on time and seeking immediate medical attention if they suspect DKA. Managing diabetes and navigating the complexities of DKA can be challenging, but remember, you're not alone. There are numerous resources available to provide support, guidance, and a sense of community. Your healthcare team is your greatest ally. Don't hesitate to ask questions, express concerns, and seek clarification on any aspect of DKA or diabetes management. Support groups, both online and in person, can connect you with others who understand the challenges of living with diabetes. Sharing experiences, exchanging tips, and knowing you're not alone in this journey can provide invaluable support. Educational materials, such as brochures, websites, and books, can deepen your understanding of DKA, empowering you to make informed decisions about your health. Remember, knowledge is power, and staying informed is an essential part of diabetes management. Take advantage of the resources available to you and reach out for support when you need it. We've been talking a lot about blood sugar and its impact on the body, but now, let's shift gears and explore another condition with diabetes in its name, diabetes insipidus, often shortened to DI. And no, it doesn't involve insulin resistance or high blood sugar like type 1 and type 2 diabetes. Diabetes insipidus is a rare condition that affects the body's ability to balance fluids. You see, our bodies are incredibly smart. They're constantly working behind the scenes to make sure we have just the right amount of water. But in DI, this delicate balance is disrupted, leading to excessive thirst and frequent urination, even when you're well hydrated. It's like your body's internal thirst mechanism is stuck in overdrive, sending signals to drink more and more water, even when you don't really need it. This can be incredibly frustrating and disruptive to daily life, as those with DI find themselves constantly tethered to a water bottle and making frequent trips to the bathroom. To grasp how diabetes insipidus works, we need to understand the role of a crucial hormone called antidiuretic hormone, or ADH for short. Think of ADH as your body's water conservation expert. It's produced in a tiny gland in the brain called the hypothalamus and stored in the pituitary gland, another tiny gland located just below it. ADH's main job is to regulate the amount of water our kidneys hold on to. When we're dehydrated, the pituitary gland releases ADH into the bloodstream. ADH acts like a messenger, traveling to the kidneys and signaling them to reabsorb more water back into the body. This helps conserve water, concentrate our urine, and prevent dehydration. Now, in diabetes insipidus, there's either a problem with ADH production or the kidney's response to it. It's like sending the water conservation expert to the kidneys, but they either don't get the message or can't act on it effectively. This leads to the kidneys excreting large amounts of diluted urine, even when the body needs to conserve water. The hallmark symptoms of diabetes insipidus are pretty straightforward: excessive thirst, known as polydipsia, and frequent urination, known as polyuria. We're not talking about feeling a little parched after a workout or needing to pee a bit more often than usual. For those with DI, these symptoms are persistent, excessive, and can significantly impact their quality of life. Imagine waking up multiple times throughout the night, driven by an unquenchable thirst, only to find yourself running to the bathroom every hour. The volume of urine produced in DI can be astonishing, sometimes reaching up to 20 liters per day, compared to the average 1 to 2 liters for a healthy individual. This constant need to drink and urinate can disrupt sleep, interfere with work or school, and make social gatherings a source of anxiety. In severe cases, if fluid intake can't keep up with urine output, it can even lead to dehydration, which can be dangerous if left untreated. Diabetes insipidus can arise from several underlying causes, and understanding these causes is crucial for determining the most appropriate treatment approach. One type, known as central diabetes insipidus, stems from a deficiency of ADH production in the brain. This can be caused by damage to the hypothalamus or pituitary gland, which can result from head injuries, surgery, tumors, infections, or certain autoimmune conditions. In some cases, the exact cause of central DI remains unknown, a situation referred to as idiopathic central DI. Another type, nephrogenic diabetes insipidus, occurs when the kidneys don't respond properly to ADH. It's like the kidneys are ignoring the water conservation experts' instructions. This type of DI can be inherited, meaning it's passed down through families, or it can be acquired later in life due to certain medications, chronic kidney disease, or electrolyte imbalances. Diagnosing diabetes. Insipidus can be a bit tricky because its primary symptoms, excessive thirst and urination, can also mimic other conditions, like uncontrolled diabetes mellitus or even excessive water drinking. So how do doctors differentiate between these conditions and pinpoint DI as the culprit? It often starts with a thorough medical history and physical exam, where the doctor will ask about your symptoms, any medications you're taking, and any family history of endocrine disorders. To confirm the diagnosis, several tests may be conducted. A urine test can analyze the concentration and volume of urine, looking for signs of excessive dilution. A blood test can measure ADH levels, which can help distinguish between central and nephrogenic DI. In some cases, a water deprivation test may be performed under close medical supervision. This involves restricting fluid intake for a certain period while monitoring body weight, urine output, and blood sodium levels to assess the body's response to dehydration. The good news is that while diabetes insipidus is a lifelong condition, it's manageable with appropriate treatment, helping individuals maintain a good quality of life. The specific treatment approach depends on the type and severity of DI, as well as the individual's overall health. For central DI, where there's a deficiency of ADH production, the mainstay of treatment is hormone replacement therapy. This typically involves taking a synthetic form of ADH, called desmopressin, which can be administered as a nasal spray, oral tablets, or injections. Desmopressin mimics the action of natural ADH, signaling the kidneys to conserve water and reduce urine output. Nephrogenic DI, where the kidneys don't respond properly to ADH, requires a different approach. Treatment focuses on addressing the underlying cause, such as adjusting medications that might be interfering with ADH action, or managing kidney disease. In some cases, medications like thiazide diuretics, paradoxically, can help reduce urine output in nephrogenic DI. Managing diabetes. Insipidus often involves a combination of medical treatment and lifestyle adjustments to help control symptoms and maintain hydration. One of the most crucial aspects is ensuring adequate fluid intake throughout the day, especially during warmer weather or after physical activity. Carrying a water bottle at all times can serve as a helpful reminder to stay hydrated. It's also essential to be mindful of salt intake. While too much salt can be detrimental to health, in DI, a certain amount of salt is necessary to help the body retain water. Your doctor can advise you on the appropriate salt intake for your needs. Wearing a medical alert bracelet or necklace can be life-saving in emergency situations, informing healthcare providers about your condition and the need for access to fluids. Diabetes insipidus, while rare, is a manageable condition that doesn't have to control your life. By understanding the ins and outs of DI, recognizing its symptoms, and working closely with your healthcare team, you can effectively manage this condition and live a full and active life. Remember, knowledge is power, and staying informed about your health is always the best medicine. If you experience excessive thirst or frequent urination that seems out of the ordinary, don't hesitate to reach out to your doctor. Early diagnosis and treatment are crucial for preventing complications and maintaining a good quality of life. Stay hydrated, stay informed, and stay empowered on your health journey. Alright, we've covered diabetic ketoacidosis, a serious complication primarily seen in type 1 diabetes. Now, let's turn our attention to another condition that can arise from poorly controlled diabetes, particularly type 2, hyperosmolar hyperglycemic non-ketotic syndrome, or HHNs for short. I know, it's a mouthful, but don't let the long name intimidate you. We'll break it down together and demystify this complex-sounding condition. HHNS shares some similarities with DKA, like dangerously high blood sugar levels, but there are some key differences in how it develops and manifests in the body. While DKA involves a buildup of ketones in the blood, making it acidic, HHNs doesn't involve ketones. Instead, it's characterized by extremely high blood sugar levels, leading to severe dehydration and a dangerous imbalance of electrolytes in the body. HHNs is often described as a slow and silent complication, as it tends to develop gradually over days or even weeks, making it even more crucial to recognize its subtle warning signs. To truly grasp the seriousness of HHNs, let's take a closer look at how it unfolds within the body. Imagine your blood vessels are like a network of rivers and streams, carrying vital nutrients and oxygen to every cell. Now picture those rivers becoming increasingly thick and syrupy due to extremely high blood sugar levels. That's essentially what happens in HHNs. The excessive sugar in the bloodstream creates a hyperosmolar state, meaning the blood becomes highly concentrated. This hyperosmolarity wreaks havoc on the body's delicate fluid balance. The kidneys, responsible for filtering waste and excess water from the blood, struggle to keep up with the overload of sugar. As a result, the body tries to flush out the excess sugar through the urine, leading to frequent urination and severe dehydration. This vicious cycle of high blood sugar, excessive urination, and dehydration can quickly spiral out of control if left untreated, potentially leading to life-threatening complications. Early detection is crucial when it comes to HHNs. Because this condition often develops gradually, it's important to be vigilant about any unusual symptoms, especially if you have type 2 diabetes. One of the most noticeable symptoms is excessive thirst, a desperate plea from the body to replenish fluids lost through excessive urination. Speaking of urination, frequent trips to the bathroom, especially at night, are another red flag. As HHNS progresses and dehydration sets in, other symptoms may surface, including dry mouth, weakness, dizziness, confusion, and even seizures. These neurological symptoms arise from the severe electrolyte imbalances and dehydration affecting brain function. If you or someone you know experiences any of these symptoms, especially in the context of type 2 diabetes, it's essential to seek immediate medical attention. HHNs doesn't develop out of thin air. It's usually triggered by a combination of factors that conspire to disrupt the body's blood sugar regulation. Understanding these triggers is crucial for taking proactive steps to prevent this serious complication. One of the most common culprits is undiagnosed or poorly controlled diabetes, particularly type 2 diabetes. When blood sugar levels remain consistently high over time, it sets the stage for HHNs to develop. Illnesses and infections can also tip the scales, as the body's stress response to illness can disrupt insulin production and increase blood sugar levels. Certain medications, such as corticosteroids, diuretics, and some antipsychotics, can interfere with blood sugar control, potentially increasing the risk of HHNS. Dehydration, whether from inadequate fluid intake, excessive sweating, or underlying medical conditions, can worsen blood sugar control and contribute to the development of HHNs. Treating HHNs is a multi-pronged approach that focuses on correcting the underlying hyperglycemia, replenishing lost fluids and electrolytes, and addressing any underlying triggers or complications. Because HHNS is a serious condition, treatment usually requires hospitalization, often in an intensive care unit, to closely monitor vital signs and provide supportive care. The cornerstone of HHNS treatment is intravenous fluid replacement. Electrolyte imbalances are also a major concern in HHNs, as the excessive urination can deplete the body of essential minerals like potassium, sodium, and chloride. Intravenous electrolyte replacement is often necessary to restore these vital minerals to their proper balance. Once the body is stabilized and blood sugar levels are under control, the focus shifts to identifying and addressing any underlying triggers that may have contributed to the development of HHNs, such as infections, medications, or underlying medical conditions. As with many health conditions, preventing HHNs is always preferable to treating it. By adopting proactive measures and making healthy lifestyle choices, individuals with diabetes can significantly reduce their risk of developing this serious complication. One of the most important steps is to effectively manage your diabetes. This includes taking prescribed medications as directed, monitoring blood sugar levels regularly, and making healthy lifestyle choices, such as following a balanced diet and engaging in regular physical activity. Staying hydrated is crucial for everyone, but it's especially important for individuals with diabetes, as even mild dehydration can exacerbate blood sugar fluctuations. Be mindful of your fluid intake, especially during warmer weather or after physical activity. While HHNs and DKA share some similarities, such as being triggered by high blood sugar levels and requiring prompt medical attention, there are some key differences between these two serious diabetes complications. Understanding these distinctions can help healthcare providers make accurate diagnoses and tailor treatment plans accordingly. One of the most significant differences lies in the presence or absence of ketones. DKA, as its name suggests, diabetic ketoacidosis, involves the buildup of ketones in the blood, making it acidic. In contrast, HHNs is characterized by the absence of ketones. Instead, the primary issue in HHNs is severe hyperglycemia and hyperosmolarity, leading to profound dehydration. Another key difference lies in the typical age of onset. DKA is more commonly seen in younger individuals with type 1 diabetes, while HHNs is more prevalent in older adults with type 2 diabetes. This difference in age distribution is likely related to the underlying mechanisms of each condition and the body's response to insulin. Navigating the complexities of HHNs can feel overwhelming, but remember, knowledge is power. By understanding the ins and outs of this condition, recognizing its symptoms, and working closely with your healthcare team, you can take an active role in managing your health and reducing your risk of complications. Remember, you're not alone in this journey. There are countless resources available to provide support, guidance, and a sense of community. Your healthcare team is your greatest ally. Support groups, both online and in person, can connect you with others who understand the challenges of living with diabetes and navigating its complexities. Sharing experiences, exchanging tips, and knowing you're not alone in this journey can provide invaluable support. Remember, knowledge is power, and staying informed about your health is always the best medicine. If you experience any unusual symptoms or have concerns about HHNs, don't hesitate to reach out to your healthcare provider. Section 1. Knowledge is power. Understanding diabetes and its complications. Throughout this journey, we've delved into the intricacies of diabetes, a complex metabolic disorder that affects millions worldwide. We've explored the fundamental differences between type 1 and type 2 diabetes, recognizing that while both involve dysregulation of blood sugar levels, their underlying mechanisms and treatment approaches differ significantly. Armed with this knowledge, we ventured further, exploring 3 distinct conditions that can arise from poorly controlled diabetes: diabetic ketoacidosis, DKA, diabetes insipidus, DI, and hyperosmolar hyperglycemic non-ketotic syndrome, HHNs. Each of these conditions presents unique challenges, requiring a nuanced understanding of their causes, symptoms, and treatment options. By unraveling the complexities of these conditions, we've empowered ourselves with the knowledge to make informed decisions about our health recognize potential warning signs, and seek prompt medical attention when needed. Remember, knowledge is not merely about accumulating facts, it's about transforming information into action, enabling us to take charge of our well-being. Let's revisit the 3 conditions we've explored, highlighting their key characteristics and differentiating factors. Diabetic ketoacidosis, DKA, arises from severe insulin deficiency, leading to ketone buildup and acidic blood. Diabetes insipidus, DI, involves fluid balance issues due to antidiuretic hormone ADH problems. Hyperosmolar hyperglycemic non-ketotic syndrome, HHNS, in type 2 diabetes leads to severe dehydration and high blood sugar. Timely recognition of warning signs is paramount when it comes to managing diabetes and its complications. Early detection can make a world of difference in outcomes, allowing for prompt medical intervention and preventing potentially life-threatening situations. While each condition has its unique set of symptoms, some common red flags warrant attention. Excessive thirst and frequent urination, particularly at night, are hallmark symptoms of both diabetes insipidus and HHNs. In DKA, these symptoms are often accompanied by nausea, vomiting, abdominal pain, and fruity-smelling breath due to the presence of ketones. As these conditions progress, more severe symptoms may arise, including confusion, weakness, dizziness, and even seizures, indicating a critical need for medical attention. Remember, your body often communicates its distress through subtle cues. Pay attention to any unusual symptoms, especially if you have diabetes, and don't hesitate to reach out to your healthcare provider if you notice any red flags. Effectively managing your diabetes is the cornerstone of preventing complications and living a healthy, fulfilling life. While diabetes requires lifelong management, the good news is that with the right knowledge, tools, and support, you can take charge of your health and live life to the fullest. One of the most crucial aspects of diabetes management is maintaining healthy blood sugar levels. This involves a multi-pronged approach, including following a balanced diet, engaging in regular physical activity, taking prescribed medications as directed, and monitoring blood sugar levels regularly. Working closely with your healthcare team is essential for developing an individualized diabetes management plan tailored to your specific needs and goals. Remember, diabetes management is not a one-size-fits-all approach. It requires collaboration, communication, and a commitment to making healthy choices a part of your daily routine. While we've focused on understanding and managing diabetes complications, it's important to remember that prevention is always the best medicine. By adopting proactive measures and making healthy lifestyle choices, you can significantly reduce your risk of developing these serious conditions. Maintaining a healthy weight through a balanced diet and regular physical activity is crucial for preventing type 2 diabetes and managing existing diabetes. If you have a family history of diabetes, talk to your doctor about getting screened earlier and more frequently. Early detection and treatment of prediabetes, a condition where blood sugar levels are higher than normal but not yet high enough for a diabetes diagnosis, can prevent or delay the onset of type 2 diabetes. Remember, small changes can make a big difference. By incorporating healthy habits into your daily routine, you're not only protecting your physical health but also investing in a brighter, healthier future. Navigating the complexities of diabetes, whether you're newly diagnosed or have been living with the condition for years, can feel overwhelming at times. Remember, you're not alone in this journey. There are countless resources available to provide support, guidance, and a sense of community. Your healthcare team is your greatest ally, providing medical expertise, personalized care plans, and a listening ear. Support groups, both online and in person, can connect you with others who understand the challenges of living with diabetes. Sharing experiences, exchanging tips, and knowing you're not alone in this journey can provide invaluable support and a sense of belonging. Don't hesitate to reach out for help when you need it. Whether you're struggling with medication management, lifestyle changes, or the emotional toll of diabetes, there are people who care and want to support you on your journey. Living with diabetes may require adjustments, but it doesn't have to define you or limit your aspirations. By embracing a proactive approach to managing your health, seeking support when needed, and staying informed about the latest advancements in diabetes care, you can live a full, active, and fulfilling life. Remember, knowledge is power. The more you understand about diabetes, its complications, and the strategies for effective management, the more empowered you'll feel to make informed decisions about your health. Embrace the journey, celebrate your successes, and don't be afraid to ask for help when you need it. With the right mindset, support system, and commitment to your well-being, you can navigate the challenges of diabetes and live life to the fullest.